following the clues. A visit to the doctor and the library. Elena Williams needs to see her health detective, Dr. Brown. Did you know there are many different reasons to go to the doctor? Elena is going because she's starting at a new school. Her grandmother also wants to make sure that she's growing well, and she wants to ask about the dry, itchy patches on Elena's arms. Mrs. Williams calls Dr. Brown's office to find out what day and time Elena can see the doctor. Dr. Brown has a phone that's answered by a machine that asks what language you want to use and then transfers you to a person who can speak that language.
You have reached the office of Dr. Marie Brown. For English, press 1. For Spanish, press 2.
Some doctors' phones are answered by a receptionist. The receptionist is the person who greets people as they come into the doctor's office and schedules the doctor's appointments. Many receptionists only know English, but people can ask for an interpreter if they're not comfortable speaking English. Dr. Brown's receptionist asks Mrs. Williams why Elena needs to see the doctor and whether the family still lives at the same address. Mrs. Williams would rather not miss work, so she asks if an evening or weekend appointment is available. Dr. Brown works with other kinds of health detectives. Sometimes Elena has appointments with a nurse practitioner or a physician's assistant. Like doctors, they've gone to school for many years to learn how to take care of people. This time, the receptionist says Elena will see Dr. Brown. Elena's grandmother writes down the date and time of the appointment on the calendar. That way, the whole family will remember Elena's appointment. The doctor's office usually calls the day before the appointment to remind them, but Mrs. Williams wants to be very sure she remembers. Elena and her grandmother get ready for the appointment with her health detective, Dr. Brown, by making a list of clues. Mrs. Williams talks to Elena about the rash and writes down the things they need to tell the doctor. Elena doesn't remember when her itchy patches started, but she remembers that they got worse when she had a cold last month, and that they get worse every time she wears her red wool sweater. Sometimes the patches get a little less pink and itchy when she puts lotion on them. Next, Elena's grandmother takes out a list of her vaccinations to take with them. Vaccinations are shots that help keep you from getting sick. Then she makes a list of her medicines. Elena takes a vitamin every day. When she had the cold, her grandmother made her a special tea that she uses to treat colds. Mrs. Williams knows that writing these things down will help them remember the important clues when she and Elena talk to the doctor. Dr. Brown works in different kinds of buildings around town on different days. Mrs. Williams hasn't been to the clinic building that they're going to today, so she calls to get directions. She knows it's important to be on time for Elena's appointment. If she can't leave on time or can't make it to an appointment, she would call to let the receptionist know. The directions were very helpful. Elena is on time for her appointment. Elena tells the receptionist that she's here for her appointment. Her grandmother fills out the papers that the receptionist hands her. Elena can see that an interpreter is helping another patient fill out forms. Elena always brings things to do while she waits. Some of Dr. Brown's offices have toys and magazines, but she likes to be sure she won't be bored.
Elena?
After a while, a nurse comes into the waiting room and calls Elena's name. The nurse starts collecting clues for the doctor. She weighs and measures Elena, then takes her blood pressure and temperature. The nurse asks Mrs. Williams why Elena needs to see the doctor, whether she has any allergies, and whether Elena has been taking any vitamins, medicines, or health treatments. The nurse is happy to see Mrs. Williams' list and records. The nurse checks to be sure Elena's vaccination record is up to date. Before the nurse leaves, she asks Elena to undress for the checkup and gives her a funny gown to put on. Now Elena and her grandmother get their magazines out again. Doctors are busy and see many patients, so Elena and her grandmother know they may have to wait a while. Dr. Brown knocks and then comes in the room. She always seems to ask a lot of the same questions the nurse has already asked. Alana and her grandmother sometimes get tired of answering the same questions, but they think about their answers very carefully because they know the answers to these questions are very important clues. Dr. Brown once told them that doctors are like detectives. They usually can't tell what's wrong just by looking at you. Instead, the doctor needs to think about all the clues before she can figure out what is wrong. Clues that Dr. Brown will think about are what Alana and Mrs. Williams tell her about the itchy patches, answers to the nurses and her questions, Elena's height, weight, and temperature, the things she sees and hears when she examines Alana, and the results of any tests that she might order. Sometimes Elena's a little embarrassed when the doctor asks her personal things, but she knows that anything she tells the doctor and nurses won't be talked about with anyone who's not helping take care of her. It's now time for Dr. Brown to examine Alana. Alana sits still and follows the doctor's directions. First, Dr. Brown spends some time looking at the itchy patches on Alana's arms. Then she uses an ophthalmoscope to look in Alana's eyes, an otoscope to look into Alana's ears and nose, and a stethoscope to listen to Alana's heart and lungs. Then Dr. Brown uses a reflex hammer to test Alana's muscles and nerves. The reflex hammer always makes Alana laugh. After Dr. Brown has finished checking Alana's body, she talks to Alana and her grandmother. Dr. Brown says those itchy patches on Alana's arms are called eczema. She says that eczema is often on the inside of the elbows, like Alana's itchy patches. Eczema usually gets worse when you have a cold and if you wear wool sweaters. Hand lotion can help eczema. See how the Williams clues help the doctor figure out what the patches were. Dr. Brown says she'll have the nurse give Mrs. Williams a free sample of a cream that should make Alana's itchy patches fade away. Then she gives Mrs. Williams a piece of paper with an order for cream that they can take to the drugstore if they need more. The paper is called a prescription. Mrs. Williams always likes to make sure she knows 3 things before she lets the doctor leave. Today she has to stop Dr. Brown before she walks out the door. Mrs. Williams wants to be sure she knows exactly what Alana's problem is. She asks Dr. Brown to spell eczema. She wants to be sure she knows exactly how Dr. Brown wants them to take care of the eczema. She asks Dr. Brown to remind her how long they should use the cream and how many times each day they should use it. She also wants to know why it's important to follow the doctor's directions. She asks whether anything bad will happen to Alana if they don't do anything about the itchy patches. When the nurse comes back, Elena asks if she's going to give her any shots or take any blood. No shots, blood, or other tests today, but the nurse does have some booklets to show Mrs. Williams and Alana. One explains eczema, the other shows how to use the cream. Before the Williams leave the doctor's office, they stop at the reception desk to see if they need to do anything else. Elena and her grandmother are glad that the doctor used their clues to find out what was wrong with her. After reading the booklet that the nurse gave her, Mrs. Williams decides she wants to read more about eczema. She and Elena go to their library. Libraries are a wonderful place to learn about health. There are many types of libraries where you can look for health information. There are public libraries, libraries in the hospital, and libraries at colleges and universities. Mrs. Williams knows that librarians can help her find the best information. After Mrs. Williams asks for information about eczema, the librarian asks a couple of questions so that she can figure out what kind of information Mrs. Williams really wants. Elena's grandmother knows that anything she tells the librarian will be kept private. The librarian tells Mrs. Williams that the library has books, videotapes, and magazine articles about eczema. There's also a lot of information about eczema on the internet, and a lot of this information is available in other languages. Mrs. Williams is very interested in the information on the internet. When looking for information, the librarian said that you should always ask, who wrote the information? What's included in the information? When was the information last updated? Why did the author write the information? And where did the author get the information? While Elena was at the library, she found some great books to read and saw an announcement for a fun class on how to search the internet. No matter what questions you have, the library is a great place to look for answers. The cream is slowly making Elena's itchy patches go away. Mrs. Williams learned a lot about keeping the pink patches away by reading the information from the doctor's office and the library. While she reads, Elena's grandmother makes a new list of questions for Dr. Brown. She thinks she may call the doctor's office with these questions or make another appointment to talk to Dr. Brown. Mrs. Williams and Elena know that part of being a good patient is asking questions and doing what you can to learn about your health. Your doctor, nurse, and librarian are your partners in keeping you healthy and informed.